What's the best food for diabetes? And what's the worst? Which food is most harmful for diabetics? In this video, I'm going to tell you everything about diabetes. What are some good post-meal practices for a diabetic? What can be considered good and what can be considered bad? Let's start with the list of the 7 best foods. I'll tell you about the best ones and then the 6 you should avoid. Actually, it's 6 types because the video would be too limited if I only talked about one specific food. So I'm going to talk about categories like number 1 on the list of the best, which is vegetables. Vegetables are excellent for people with diabetes. And I'm going to use broccoli as an example here. Why? Broccoli is a source of vitamins and minerals. Broccoli also contains calcium and antioxidants that help you in the process of controlling diabetes and often even reversing type 2 diabetes. For type 1 diabetes, the autoimmune disease, there's only management, but with type 2 diabetes, it's often possible to achieve reversal by modifying the factors that cause it. And diet is one of those factors. So improving your diet is one of the steps to gain control, and in some cases even reverse type 2 diabetes. Later, I'll explain the criteria used to consider diabetes reversal. But on the list of best foods, I'm putting vegetables here, highlighting broccoli, radishes, cucumbers, cauliflower, and dark green leaves. They're excellent for diabetics. Arugula and lettuce are also beneficial as they're sources of magnesium and copper, which can improve the process. Don't forget pumpkin and zucchini. So vegetables are our number 1 item. There are some exceptions you need to be more careful with, which also fall into the worst category, vegetables that have a higher starch content, like potatoes, corn, and peas. You need to be especially careful with these 3, but generally speaking, vegetables are excellent and make it to the list of the best foods. And number 2, which couldn't be left off the list of the best foods, are fruits. On this list, I want to give a special mention to apples. They're rich in fiber and also contain antioxidants. Remember to eat them with the skin on, okay? If you can't buy organic apples, you can clean the skin with a scrubbing brush. If you're concerned about pesticides, simply scrubbing the apple can significantly reduce their presence. This is a simple and cost-effective way to minimize pesticide exposure. While you can't eliminate all pesticides, especially those absorbed systemically, this method can greatly reduce their levels. Eating apples with the skin on not only provides fiber, which helps with feeling full, but also improves digestion and lowers the glycemic index of other foods. Foods high in fiber aid in digestion, and apples contain pectin, a soluble fiber that can help improve your cholesterol levels. We know that diabetics need to be careful with cholesterol due to cardiovascular risks, including the risk of heart attack and stroke. That's why it's crucial to consume fiber-rich foods with a low glycemic index and low glycemic load, meaning they're low in sugars. Apples tick all these boxes, making them an excellent choice. What other fruits are also considered among the best? Red fruits, for example, strawberries, lemons, and avocados also have good fats that help with cholesterol issues. They have significantly lower sugar and carbohydrate content, so avocado is an excellent choice. Guava, orange with pulp for the fiber, peaches, and nectarines are excellent fruits for people with diabetes. And I can't forget to mention passion fruit. There are so many great fruits, but passion fruit definitely deserves a spot on the list. So, fruits with a low glycemic index, which measures how much a food raises your blood sugar when you eat it, are ideal. These fruits won't cause a spike in your blood sugar levels, so you won't need a corresponding spike in insulin. There's a question here about whether an insulin spike would be harmful or not. If you don't have diabetes, your body can control this on its own. So you can eat some foods that will temporarily increase your blood sugar and cause an insulin spike. And this is physiological. It's normal. You won't become sick because of it. Now, if you already have diabetes during this insulin spike, insulin can no longer act effectively. It can't perform its function of taking sugar from the blood and putting it inside the cells and muscles. So this is definitely something diabetics need to pay close attention to, okay? It's not just about the insulin spike, it's about the insulin spike in diabetics, which can cause a change in blood sugar levels. And for number 3 on the list of best foods for diabetics, I'm going to put fibers and seeds. Here's number 4. I've never mentioned this before, but you guys ask about it a lot. Pumpkin seeds and sunflower seeds are indeed good for people with diabetes. They contain various vitamins, help with daily fiber intake, affect the glycemic index of foods, improve absorption, and slow down the absorption of these foods, which in turn reduces blood sugar spikes. So these fibers are excellent. And 2 that you're already familiar with are chia seeds and flaxseed. Many people ask if golden flaxseed can be used. Yes, it can be used. There's no problem with that. It really comes down to your personal preference. How do you plan to use them? Of these fibers, I use chia seeds. Which one do you use? I like to add chia seeds to yogurt and mix them with fruits, but it's really up to your taste. I'd even invite you to share your recipe here in the comments. If you use these fibers, let us know how you use them. This serves as a suggestion for other diabetics and also contributes to the richness of this video. I know you're going to ask about oatmeal. Is oatmeal good or bad for people with diabetes? Whenever we talk about fibers like chia, flaxseed, and other seeds, you always ask about oats. Oatmeal is not good for people with diabetes. Oats are healthy, yes, but only if you don't have any issues with your metabolism, blood sugar, or insulin. Why? Because more than half of oats composition is sugars. Some studies say it's over 65%, others say 60%. It varies quite a bit, but everyone agrees that most of its composition is sugars. And if you're diabetic, you need to be especially careful with sugars. I'm not trying to badmouth oats. I eat oatmeal myself. Oatmeal has properties that can improve your cholesterol levels. More specifically for diabetics, which is the topic of this video, you need to be extra careful. And if possible, replacing oats with other fibers I mentioned would be a great choice. And number 4, the 4th best food for people with diabetes is eggs. Eggs are a source of protein, lean protein. And here I'm talking about whole eggs, both the yolk and the white. Many people recommend removing the yolk because of the fat, but that doesn't make sense. The yolk contains good fats and vitamins that help with cognition and vision, B-complex vitamins. So it doesn't make sense to remove the yolk. You should eat the whole egg. I'm talking about 1 to 2 eggs per day here. If you eat more, well, there are many athletes. You've probably seen some videos. Those people who go to the gym and then eat several eggs. In that case, yes, those people might need to remove the yolk because of the quantity. Now, for those of you who eat 1 or 2 eggs a day, which is a very healthy amount, don't worry, fat isn't going to harm you. On the contrary, eggs contain good fats along with vitamins and minerals that can actually help boost your metabolism. So, eggs are definitely a good choice. I eat eggs every day myself. I consider them an excellent and very well-rounded food. Keep in mind that if you're diabetic, you need a minimum amount of protein, and eggs can really help you meet that requirement. Number 5, olive oil. Olive oil is a powerful anti-inflammatory and also contains healthy fats. So, what's the recommended dose of olive oil for cardiovascular protection? 7 to 10 milliliters per day is a safe amount of olive oil that provides benefits without adding excess calories. What's the downside of olive oil? While it's high in calories, it contains good fats that can benefit your heart and won't raise your blood sugar. The main issue is its calorie content. So, you need to be careful. If you use the amount I mentioned, you'll be doing something good for your health. Many people ask if I put olive oil in a frying pan, for example, won't it transform from a good fat into a bad fat? No, that doesn't happen. This transformation only occurs at extremely high temperatures. You can't actually reach the temperature needed to turn olive oil into a harmful substance on your home stove, for example. So you can relax. You can safely sauté vegetables in olive oil, for instance, without any issues. There's no need to worry about the smoke point of olive oil, despite what many internet videos might claim. You can't transform it into an unhealthy food on your home stove. So there's no reason to be concerned. Feel free to use olive oil for heating and cooking foods as you prefer. It's much better to use olive oil than butter, margarine, or other animal fats like lard, or even vegetable fats. Coconut oil itself is high in saturated fats. In fact, most of coconut oil is composed of saturated fats, which can increase your cardiovascular risk. Not only do you get excess calories, but you also face an increased health risk. Diets high in saturated fats increase the risk of cardiovascular disease, and diabetics should pay extra attention here. Number 6. Fish and seafood, like shrimp. Shrimp is excellent for people with diabetes. Lobster, crayfish. I know many people will say lobster is expensive, but we have to remember that people from all over the world watch this channel. In many countries, lobster is affordable, just like fish such as tuna, salmon, and sardines. But I'm not going to limit it to just these omega-3 rich fish. I'm including fish in general here because they're sources of lean protein that can help you in this process. Now, regarding seafood like shrimp, lobster, and even some fish I mentioned, if you have high uric acid, known as hyperuricemia, you'll need to be extra careful because seafood can significantly increase uric acid levels. However, if you're diabetic and your uric acid is under control, then these are excellent choices and make the list of best foods for diabetics. For number 7, I want to mention something I love and drink every day. Coffee. Do you drink coffee? Coffee is the most consumed beverage in many countries, and it's rich in antioxidants, including tocopherol, which is vitamin E. Coffee is a potent food that can have numerous health benefits. In fact, studies have shown that coffee can reduce the risk of developing type 2 diabetes by 33%. So, coffee is a great ally for your health. Now keep in mind, I said coffee can reduce the risk, not eliminate it entirely. If it were that simple, everyone would just drink coffee and no one would be diabetic. So don't misunderstand this video. Be cautious with the tips I'm sharing here. They're about reducing risk, not eliminating it completely. Another interesting fact about coffee is that it can help people with fatty liver inflammation known as steatohepatitis. We also know that diabetics have a higher chance of developing fatty liver due to risk factors like obesity. So that's another point in favor of drinking coffee. But what's the right amount of coffee to get the benefits without the risks? Just like I mentioned with olive oil, if it's filtered coffee, you can have 3 to 4 cups a day, which is about 600 milliliters. If each cup is 200 milliliters, which is a medium-sized cup, then you can have up to 3 cups a day. Why? Each cup contains about 100 milligrams of caffeine, and 300 milligrams of caffeine is a dose that shouldn't put you at risk for things like arrhythmias, for example, or cause changes that many people report in blood pressure or even trigger an anxiety attack. This dose should allow you to get the benefits without the risks I mentioned. But some people are more sensitive to coffee and might show symptoms even with low doses. Yes, that's also possible. It varies case by case. But generally, coffee is an excellent food. Since I mentioned the risk of arrhythmias, this effect of increasing cardiac arrhythmias starts to happen from 8 cups a day, 8 doses of coffee. If it's espresso, then it would be 3 to 4 shots. The dose of espresso is typically 30 to 50 milliliters, depending on the machine you use to make the espresso shot. And there are even some manual methods for preparing espresso. But it's about 3 to 4 doses. As for those negative effects of coffee I mentioned, they occur at 8 or more doses. That's what studies have shown, keeping in mind that there's also an individual factor to consider. I really enjoy coffee and drink it every day. I prefer espresso, and here I'm talking about coffee without sugar. I hope you don't add sugar to your coffee, but if you do, try a gradual withdrawal. In 1 week, reduce it by half, then half again, and in about 3 to 4 weeks, you can remove it completely. You'll see that after you manage to remove sugar from your coffee, you won't be able to drink sweetened coffee anymore because the taste is different. It's much better. What about sweeteners? I know you're going to ask about that too, so I'm addressing several questions here in this video. Are sweeteners harmful for people with diabetes? No, sweeteners don't harm diabetes or raise blood sugar levels. I'm aware of some videos claiming that the sweet taste of sweeteners could cause an insulin spike, but that's absolutely ridiculous, okay? There's no scientific evidence to support that claim. So if you're diabetic, you can consume natural sweeteners without any worries. They won't harm your health and will actually help improve your blood sugar levels. What are some natural sweeteners? Stevia, xylitol, and erythritol. But what about artificial sweeteners? Do they harm diabetes? Not at all, but there are other controversial issues that could even be topics for future videos, like the relationship between artificial sweeteners and health. There's a lot of talk about dosage, but I'll focus on natural sweeteners here. Otherwise, this video would be too long, and I'd lose focus by only talking about artificial sweeteners. It would take at least 20 minutes to explain that clearly so you can understand. But natural sweeteners aren't harmful, so you can add stevia to your coffee without any problems. Now, what are the worst ones? The 6 foods you should avoid if you're diabetic, which can harm your health. Remember, I'm talking about avoiding, okay? Forbidden foods ends up being a very strong phrase. Oh, but I'll never be able to eat again. Well, it's not quite like that. But if you can cut these out of your diet, you'll be doing yourself a big favor. And number 1, you already know this one, it's added sugar. So refined sugar, demerara sugar, crystal sugar, any type of sugar you add to your diet, you should eliminate. Why? Because they're simple carbohydrates that will raise your blood sugar levels. Remember when I talked about putting sugar in coffee? Well, this applies to all foods where you might add sugar. Cut out the sugar, because it's one of the things that most hinders diabetics' control. If I were to look in your fridge or pantry, would I find sugar? I've already removed it from mine, and I invite you to do the same, so you won't be tempted to use sugar or add it to a recipe or any food you're preparing. There's really no reason to keep sugar at home. Many friends who visit my house are surprised. They ask to sweeten something, even drinks like lemonade or passion fruit. And when I don't add sugar, they're surprised because it really doesn't need it, and you won't miss it once you get used to it. The second type of food you'll remove from your diet are foods high in saturated fat, like fatty red meat, bacon, and pork rinds. These foods can increase your bad cholesterol and worsen or increase your cardiovascular risk. I know there are many videos claiming that animal fat doesn't harm humans, which is a big lie. It does harm you, and you should avoid saturated animal fat, okay? And number 3 is sugary drinks, like sodas, but not just those. I want to draw attention to what many people think is healthy and good for diabetes. Fruit juices such as grape juice and orange juice. Why? When you remove the fiber from an orange, for example, and make juice, you're just taking the liquid without the fiber, which has a much higher glycemic index and a much higher sugar content. So, fruit juices aren't good for people with diabetes. Of course, there are some exceptions, like lemon juice, which you'll dilute a lot. Passion fruit juice is another one that's okay for diabetics, but as a general rule, fruit juices like apple, orange, mango, pineapple, and grape juice should be avoided if you have diabetes. Keep in mind that grape juice does have many beneficial properties, but I'm specifically talking about diabetes here. If you have diabetes, you should be careful with it, and if possible, avoid it altogether. Remember that unlike solid foods, you should also avoid whole fruit juices, because whole fruit juices, as the name suggests, don't have any added water, so they're more concentrated and contain a higher amount of sugars as a result. Other drinks like chocolate milk, sweetened beverages, and drinks with syrup should be avoided too. If you have diabetes, it's best to completely eliminate these from your diet if possible. Number 4 is ultra-processed or processed foods. Things you buy ready-made in a box, for example, boxed pizza, boxed lasagna, pre-made hamburgers, those packaged hamburgers that come in a box at the supermarket too. These foods, besides going through multiple processes, which is why they're called ultra-processed, they're not good for your health, and if you have diabetes, you should avoid these foods. And number 4 also includes foods high in sodium and preservatives like processed meats. Processed meats like salami, coppa, salamito, ham, and turkey breast contain nitrates and nitrites that have been linked to an increased risk of colon cancer. But that's not the only reason to be cautious. These foods are also high in sodium, which is something diabetics need to be particularly careful about. Now, I'm not saying sodium is inherently bad. I'm talking about consuming too much of it. So what exactly counts as excessive sodium intake? According to the World Health Organization, the ideal sodium intake is up to 2 grams per day, with salt consumption limited to 5 grams per day. If you eat foods like salami, for example, you'll easily exceed this recommended limit. We also know that high sodium consumption can worsen another common issue for diabetics: high blood pressure. So it's crucial to keep an eye on the amount of salt and sodium you're consuming in your diet. If you check the labels and packaging, you can get a good idea of how much sodium each food contains, so you don't exceed the recommended limit. But if possible, try to completely avoid these processed and ultra-processed meats. Other foods that are also very high in sodium include instant noodles, for example. And don't forget about sauces, especially the ready-made ones. It's better to make your own sauces and seasonings at home. Not only will it be healthier, but it'll taste much better too. And number 6, the last type of food you should avoid if you have diabetes, are foods made with white flour, such as cakes and wheat flour products. Why? When you consume white flour, it contains a higher amount of sugars. These are simple sugars that your body quickly converts to glucose, causing your blood sugar to spike. The same goes for pasta. So if you're going to eat pasta, choose whole wheat pasta or use whole wheat flour instead. Put it in the recipe. For example, if you really want to eat flour, then go for whole wheat flour because it has a bit more fiber. It's still not an ideal food and won't make the list of best foods for diabetics, but it's a less harmful option, okay? So if possible, avoid white flour. Remember, I promised to talk about the criteria for reversing type 2 diabetes and what's considered a good test result for diabetics. What's a good blood sugar level when you test with a device like a glucometer or glucose meter? I'll start by discussing the criteria for reversing type 2 diabetes. Keep in mind that this isn't my personal opinion. This information comes from the American Diabetes Association, which is currently our leading authority on the subject. What exactly are these reversal criteria? We use a test called glycated hemoglobin, which measures the average blood sugar level over the past 90 days. What are the significant values for glycated hemoglobin? A normal value would be up to 5.6. Pre-diabetes ranges from 5.7 to 6.4%, and diabetes is 6.5 or higher. Keep in mind that ideally, you should repeat this test twice to confirm a diabetes diagnosis. If you're already being monitored, you don't need to repeat this test. But what's the criterion for diabetes reversal? If you maintain values below 6.5 for 3 months or more after your doctor has discontinued your diabetes medications, that's considered a reversal. If you're taking any medication, then this criterion doesn't apply. It's really important to remember that this happens quite often in practice. I've heard patients say many times that their result was good, thinking it's a reversal. But if you're taking medication, it doesn't meet this criterion. Remember, only your doctor can tell you when to stop taking a medication or when to start a new one. When it comes to diabetes and blood sugar levels, there's a very dangerous condition called hypoglycemia. It's just as dangerous as hyperglycemia. Extremely low blood sugar can also be a medical emergency, so it's crucial to always keep this in mind. Now let's talk about what are considered good values in the capillary glucose test, the one you do with a glucometer or glucose meter. We typically use a 2-hour post-meal measurement to see how food impacts the blood sugar levels. For diabetics, values up to 180 milligrams per deciliter are considered good. If you're in a country that uses millimoles per liter, that value would be up to 10. We use these values to determine if blood sugar levels are under control after eating. Now you might be thinking, wait, isn't up to 180 or 170 still pretty high? For fasting levels, yes it would be, but remember, we're talking about post-meal values or postprandial levels, so values up to 180 mg/dL or 10 mmol/L are considered acceptable. For non-diabetics, I know you'll ask this too. Values up to 140 milligrams per deciliter or 7.8 millimoles per liter are considered acceptable. Did you enjoy this video? On a scale of 0 to 10, how would you rate it? Come on, this video deserves a 10, doesn't it? I've included a lot of important information in this video. It's the first one where I'm going to ask for a 10, and I hope you think it deserves that too. Let me know in the comments which city and part of the world you're watching from. I'm curious to see how far this video has reached. I'm speaking to you from Porto Alegre. Now, I'd like to suggest another video for you to watch. It's one where I talked about coffee. Did you know that coffee has benefits for people with diabetes? Would you like to know about the other benefits of coffee? In that video, I also discussed the potential risks. It's definitely worth watching if you're a coffee drinker or if you're thinking about starting because of this information. It's better to be informed. Take care and I'll see you next time.